So if a person feels or notices that an activity that they normally would enjoy, if they can't enjoy that activity, there's a good chance that they have depression. Clinical depression, there's very specific criteria for what we call a major depression. But basically it means that the person's level of functioning is affected, whether it be functioning at home or at work, due to symptoms that include feeling depressed, feeling anxious. Often the person has difficulty concentrating. They may have sleep disturbance, often with insomnia, difficulty sleeping at night, sometimes too much sleep, having a difficult time getting out of bed. Often there's appetite disturbance and weight change, sometimes eating too much, often weight loss due to a decrease in appetite. And another very important symptom is what we call anhedonia. It comes from the Greek word hedonism, and anhedonia is an inability to enjoy oneself. So if a person feels or notices that an activity that they normally would enjoy, such as having a catch with a kid or going to the movies with a friend, if they can't enjoy that activity, there's a good chance that they have depression.
So bipolar disorder is a type of mood disorder where we see both manic episodes, which are very high highs that can interfere with a person's functioning. So they might have a lot of ideas, of creativity, but it keeps them up late at night and they can't get normal day-to-day stuff done. And the lows are extremely low. They're very depressed. They can't get out of bed. They feel that everything takes a lot of energy out of them. So basically you have these two mood extremes, and at the same time you have difficulty functioning. So when we talk about bipolar disorder treatment options, it's important to keep in mind that medication will definitely be a part of it. Within the medication categories, there's anti-epileptics, there's mood stabilizers, antipsychotics, anticonvulsants, benzodiazepine. There are a variety of medications that are available that are quite effective. So really it depends on the individual. The doctor has to very carefully look at the treatment approach based on who they're dealing with and what they're looking for. Having said that, medications being an important part, I'm also a big believer in psychotherapy. Psychotherapy makes lasting changes in the brain. We have found that areas in the brain that are pertaining to fear, the hippocampus, the amygdala, that these areas really are able to shrink, so that sort of the anxious fear response that we see in depression, that we see in mania, is able to decrease. Once bipolar disorder is diagnosed and people are able to get treatment, I want to assure you that people can lead very fulfilling, productive, and enriching lives. People with bipolar disorder are really going to have to be their biggest self-care advocate. Staying well for people with bipolar disorder means knowing your triggers and, as much as possible, either avoiding them or planning in advance around them. That might mean knowing travel coming up ahead, a move, a more stressful position at your job, needing more family support at home. So being your best advocate, asking for what you need, planning in advance, and saying no when necessary. People with bipolar disorder, in my experience, who do the best are people who have excellent family support, so definitely engage the people around you, friends and family, and being in close contact with your treatment provider and being aware of your medications and the side effects and taking your medication every day is going to be really important in maintaining stability when a person is dealing with bipolar disorder.
Keep a daily gratitude journal or just write 3 thank you notes every night. I do. Taking the time to say thank you and connecting with the most meaningful forces in your life can remind you of all the good stuff, especially when the going gets tough. 2, this is really important, replace junk food with foods that taste great and are great for your brain power. A steady diet of burgers, fries, and sugary baked goods laced with salt increases your depression because these foods fuel inflammation. Instead, pile your plate with fruits, veggies, and the good fats found in nuts, olive oil, and fish. 3, upgrade to first-class sleep. Close the shades, turn off the screens, wear an eye mask. 4, bust a few yoga moves. If you're not into finding your inner a walk is good too.
Anxiety is our body's response to stress. Whenever we're faced with some sort of threat or pain, then anxiety is what comes up in order to protect us from that. Now, when we experience anxiety issues or anxiety problems, that's when we start to assign threat to things that are not necessarily threatening to us. There's multiple ways that anxiety and depression are related. When we think that things aren't going to work for us, we're expecting the worst outcome. And so therefore, we're afraid to take action. One of the ways that you know that you have anxiety is that you are going to feel uneasy all the time and you're going to have racing thoughts because your brain is trying to solve a problem for you. The way that we talk to ourselves, the way that we tell ourselves about certain problems very much impacts the way that we feel about it. The more that we think about things, the more problems that come up in our minds. And so that's going to kind of catapult us into starting to ruminate about problems. But the problem is that if you don't stop yourself and you don't choose a solution and you allow your brain to continue to think about all the worst case scenarios, that's where anxiety really starts to hurt you. And we have this intense fear that if we make the wrong decision, that it's going to be some sort of a catastrophe. And so it's really important to recognize those types of thoughts that you might be having and your inability to, make decisions the way that you used to.